Hello, everyone, and welcome back to another episode of Our Own Devices with Nandagopal Rajan. And I am, predictably, Nandagopal Rajan speaking to you again. We are in a situation where we might be thinking about a little bit of the pandemic again. And this might be the right time to have a discussion about how technology has impacted the world of health science in the past couple of years, especially. With us to speak about this is somebody very knowledgeable about that specific topic, and this is Atul Kurani, who's global head of the medical practice and IoT at Capgemini Engineering. Atul, welcome to the show.
Hi, good morning, Rajan. How are you?
Yeah, sir, it's a pleasure to have you here. So, if I can just start by asking a very basic question, because we will have a lot of people who are not really aware of Capgemini and what Capgemini does. If you could just tell us a little bit about how Capgemini works in the space of medicine, and what is your how do you impact this sector as a whole?
Definitely. For the people who are in India, definitely Capgemini is one of the largest service provider both on IT and engineering space. We just crossed our 300,000 employee last month, and we crossed out of that 150,000 employees in India just a couple of months back, which means that we are almost 50% of our strength in India. Out of this 300,000 people, almost 25% of our business is engineering business. And engineering business is all about providing our customers product engineering services, which leads to uh, developing the products for their end customers. And we provide the services in automotive, aerospace, healthcare, networking, and I can say communication lines. We do provide a lot of work on Industry 4.5, 4.0, and so on. Healthcare has been a, I can say, jewel of Capgemini Engineering, and we have been a leader in this space for last almost like a decade plus. And we provide like engineering services to a global majors in med devices, biotech, and pharma. These are the three segments in which we work in a life science sector. I lead the entire global offshore team along with my team, which are based out of various geographies for pre-sales and solution. And that team is close to, like I can say, like a large number, which forms a formidable business for Capgemini.
So, almost all the companies in the technology side have seen a big impact because of the pandemic, right? And mostly it's been a positive
Hmm.
impact because there's been a spike in use cases and adoption. Because without tech in this pandemic, we would have really we really don't know where we would have been, right? And I'm sure the health sector, which is actually at the center of all this, has also been impacted hugely. So, can you tell us a bit about what has happened in India, especially and globally? Purely from an adoption perspective, from an acceleration perspective, because of the pandemic.
See, what we say is change is constant. At least in pandemic times, I think we are living in such a uncertain time that nobody knows what is going to happen in next 2 months. What would be the new variant coming up? What Whether we will be working from office, whether we will be doing a remote work, whether it will be a hybrid model, whether we will able to fly, whether we would able to travel, and so on. So it is a VUCA world, entire volatile world, right? And the only way you can really be prepared here is that you are having little bit ahead of a curve, and think from that angle that how are you are prepared for, let us say, next quarter. If something happens, then how well you are prepared. In that area, I think the digital technologies have helped us a lot. Digital acceleration did happen during this last two times. Some of the, I can say, technologies which were in experimentation in a beta mode actually became a mainstream technologies in last 2 years. And surprisingly, things got proven using that technologies, and people have started putting a lot of faith on that technologies. Namely, mostly it is on data, on analytics, a lot of things on AR VR, huge focus on really like working on cyber security, a lot of work which are happening on telemedicine side, and so on. So these are some of the technologies which I would say like was always there, but not happening on a scale. and all of a sudden, due to pandemic, we started experimenting these technologies. They started proving itself. Normally your testing cycles, which like for any vaccine would have been 5 to 7 years, or for this technologies it would be couple of years. But like what we did for vaccine, possibly we did a limited trials because of a want of time, and uh, I can say release that. Similar thing happened with this technologies, where most of them were possibly like put into test in just virtually within a quarters of time, and so many new applications in healthcare came in just possibly a quarter. And every day new healthcare, I can say, like applications are launching, a lot of new companies are launching everywhere. It is all about like how you can do something from data, where you can reduce the time for the doctors. You can really work on the scarcities of a caregiver. You can work on optimizing your assets, specifically on the instruments in the hospitals. You can do something of uh, I can say value to the patient in a very very limited time. And most importantly, most of the things are funded by government, so it has to be cost sensitive also. Now all these things just happened due to COVID. I would say that this technologies wouldn't have accelerated to the to the velocity what it is having right now if the pandemic was not there. And I can elaborate a lot. I take a simple examples like right now, if you see like a typical radiology images, if you were to do it for your endoscopy, it may take 8,000 images. In a doctor, if it was studying this entirely, it may take him anything between 2 to 4 hours to figure out where is the aberration, where is the tumor, and so on. Then you come with a, let us say, the entire uh, analytics over it, and then put an algorithm over it. Possibly you can localize that 8,000 images to say, let us say, around 80 images, and then doctor has to go only that 80 images, and possibly he can give you I can say like results in 15 minutes. And in that case, while you have still not removed the, I can say, radiologist out of the picture, you still require a doctor, but possibly you have reduced his time I can say 1/8 or even 1/16 in most of the cases. And that's where he would able to do too many, I can say, studies, interpretation in an allocated time, that eventually will help in patient care, in serving in terms of volumes, and eventually like reducing the cost of care also. So like these things did happen. Right now I think across the globe, this particular use case has been proven so much that everybody is using radiology as one of the, I can say, use case, where each of the countries are saying that how they are able to work specifically with radiologists sitting in the cities. And India, where 70% of us are in rural, I can say, population, and radiologists are not available in the villages. Can you do, I can say, anywhere imaging in a nearby center, and then send it across to a metros, and then a radiology can provide an interpretation? This is a big boost, and this happened in last 2 years.
It's actually a very interesting example that you took. And one of the things that we saw during the pandemic is the fact that because you cannot walk into a hospital like before, a lot of people have literally moved to online consultation. And the good thing about online consultation is that you could be in a very small village somewhere in India, but you have, in a way, access to the best doctors across the world, right? If you're willing to pay, if you have the right time, but and you can and you don't need connections or anything other than your internet connection to get connected, literally. So even after the pandemic, this is the way, our medical system is going to develop, because it becomes much more democratized and much more accessible to everyone.
Definitely, I think one of the best thing India did in last 1 decade is investment into the infrastructures for internet. Right now, possibly we are the largest country having a, I can say, internet connectivity to the, possibly the last man standing there, and having almost like 1.3 cell phone per user in a country which is having 1 billion plus population, right? So the penetration of internet did have. And then till, I can say, till 3G, we were laggards, where the network connectivity speeds were very low. 4G virtually we released with a little lag with other countries, the developed countries. And 5Gs, we are in fact ahead, or we are launching 5Gs at the same time as anywhere it is happening in the world. So the infrastructure on internet did help a lot. Now with this, what really happened was that telemedicine really like became a major, I can say, savior for people's life. Just see like a pandemic which is airborne, and it has that type of problem where you cannot travel and so on. How many life would have been lost if this telemedicine was not there. Getting a remote consultation over a phone on what to do and then to save the life has been something which I would say India would be very, very, I can say, happy with what we have achieved in last 2 years. 500 times the teleconsultation improved only from 2020 to 2021. 500 times. Okay, just see this thing. Right now we have almost like people who have never used telemedicine. There are 88% of them are first time users. First time you are using, straightway getting connected to the doctors, taking a medicine, and then you are getting cured. This is and the success rate of that 88%, what is there, is close to 80%, which means that almost people who took a telemedicine, got an advice, they did what was required, and I can say opined by the doctors, and they have really like got cured out of it. So telemedicine really happened, one, because of the internet, but then there are a lot of platforms and application came. One of the thing which you should always remember, that when you are doing telemedicine, you are also gathering a lot of data. From a data, and specifically when you're in pandemic, you will get a lot of extrapolation, and you will get a population, I can say, analytics out of it. That if I'm getting 5 patients from this remote village, possibly from some district in remote Bihar, you will know exactly what you can expect from that district in Bihar using analytics and AI over it, right? And then you can do a lot of things ahead of time. And it is all about ahead of time using technology in COVID times, which is totally uncertain. So if you are ahead of time, whether it is going to be Omicron or anything else which comes out in future, this data what we have got it, and this platform of telemedicine what we have built on, I think like that will help us a lot, apart from the vaccination program which government has taken with I can say huge efforts.
Sir, it is interesting that you brought up the point of data, and this is something which I wanted to learn from you. Is that of course you have so much data now in the healthcare space. It's as big as any other sector. But so if you look at hospitals in India, for instance, or governments in India, are they really tapping into this data? And are we using it also beyond the platform? As in, you gave a good example of a platform using that data. But as far as I know, you can actually use data to pinpoint like where a cancer could be developing in your body also, right? Because there are so many trends available from across the world. So how much are we reliant on this data, making use of the data?
No, no, that is a very interesting thing which you said, and that is very important. See, like really like entire AI journey, if you take it down, it is a data journey. It is from data to information to knowledge to wisdom. Okay, that's the way the data really do. To reach the wisdom, possibly your journey starts with collecting the data. In fact, you may not even know that what lot of correlation of a data may bring a wisdom. And whether it is you were looking for maybe like a COVID, and you figure out that this guy is suffering from a cancer, can really happen because of a correlation engine. Now important part is that once you are starting collecting this data, whether it was due to COVID or any other reason, you have that data available with you. Applying a data privacy over it, and then really like making sure that you are using all the cybersecurity measures. Now if you run the entire AI engine over it, you would able to get totally like a, I would say like a information which you would have never even imagined, right? And in that case you will still able to reach out to that population, and you will really do something which is preventive. Now just see like what it is going to do. Have you ever heard in US, and I'm coming from my example because in Capgemini, most of our customers happen to be there in US, and then I'll bring out the analogy in India, is that most of the times everything has been paid by an insurance company, right? An insurance company is really like always worried that the diagnosis which is going to come out should not lead to a repeat procedure, because in that case insurance company will have to pay 2 times, right? So they want to get it first time right. To get first time right, what are comorbidities, what could be something more complications, everything comes from a data part of it, right? And if you can correlate that particular part, they are saying that the accuracy of a data will lead to, I can say, reduction in insurance costs. Now the insurance costs in a time of COVID actually is going to reduce considerably over the next 10 years in US. And that's where insurance companies started paying for a teleconsultation in US. Otherwise teleconsultation was never covered as a part of an insurance payout. The reason why they are doing is that while you are giving an advice on COVID, you are getting all the data which will help you in reducing your cost in next 10 years. Okay, now just see, here you are sitting on a population of 1 billion plus people, and if you start getting the data out of it, because everybody has a mobile part of it, and if you can have a sensorization using a very very, I can say, basic thing. So if you even use like a basic accelerometers, or really data of how much you are walking throughout a day, some of the sensors which definitely like most of the people in metros are using, fitbits and so on, you are getting it down. Lot of medical devices are getting retrofitted for IoT and sensorization of it, and you start getting the data out of it. You will able to get a data which will be worth in millions, I can say, over a time. I'm not talking about the money part of it. It will lead to a better, I can say, sound and healthy people in population over a period of time. So in a way, pandemic, though it is a very very tactical things we are doing, using collecting a data, using the telemedicine solution, it will in a long term will become very strategic, and it will help you to actually like provide a healthcare which will be affordable by everybody, as well as you would have a lot of information ahead of time, and in general it will improve the quality of life, and most important, in your age of the life also. So both the things, it will help over a period of time. Now, coming to a very specific point solution, one is all about platform, and platform is all about data. But I'm not talking about platform. There could be a lot of point solutions. I'm not saying that you always have to build a platform. Right now my information says that almost 500 plus government hospitals are e-hospitals, which means that there is no physical hospitals. It has everything. So it has a I can say tele ICU, it has a tele, I can say, radiology department, it has a tele, I can say, ultrasound department, and so on. Everything is tele, and they are getting a data from a physical site from other hospitals, and they are just collecting the data, and then the experts sitting in that tele hospitals is providing all expert advices to these hospitals, where you may not have expert doctors in that ICUs, or if they may not even have an ICU. Okay, they may be having just a med surg department and so on. This thing, possibly like you will see that how a ultrasound data can really help you over a period of time on really like looking into pancreatic cancers and so on. This could be a point solution, and you can just look into that type of trend out of it. It has nothing to do with COVID, and you will still able to do a point solution out of it. Now, this journey which has started because of this COVID, I would say like it is a blessing in disguise. Okay, I never thought that we would accelerate this journey with this pace. Very clearly everything is about digital, and I'm telling you this with a very like a little bit of a cautious part of it. I said that everything about data is data to information to knowledge to wisdom. Till you are reaching a wisdom part, it is investment journey. You have to invest, 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 and invest. Where are you going to invest when the cost is rising? Okay, you have to create all the systems, and costs are rising, and you will require a brain which is going to come from intellects and talent which is available in the country. There are 80% of digital talent lies in India and China, and due to polarization of countries, who will go with China and India, India has definitely won this war. And that's where all the digital solutions will come out of this country. This is the first time in history where we would not be I can say, smart followers. We would be actually leading the innovation in digital space, specifically in healthcare, because digital talent is in India.
Yeah, that's very very interesting. Also, it's great that you mentioned about insurance. Now I understand why my insurance company gives me a cashback for actually meeting my step goal every day. So I get a daily cashback if I meet my yeah. But they are in the end mitigating their risk and based on data, right? Absolutely, that's a very 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 interesting point. I'm sure a lot of our readers would also now start associating why your insurance company is hyperactive to get you onto an online consultation, because they're just trying to latch into your data and understand where you are. So, in the past, couple of years, it's been a very challenging time for everyone. I'm sure, for your company also, you're helping the people who are at the real forefront of taking on the pandemic, which is a global event. But uh, if you look at the biggest challenge, what has been your biggest challenge so far in the past couple of years?
See, I think like biggest challenge always, at least I'm say solving this particular problem is really like what is the availability of caregivers, to be very
Yeah.
very true. And then the second thing is what is the availability of the assets which are requiring for assisting the caregiver. These are the two things. Taken examples around 1.5 years back when we ran out of the ventilators. Take an example of a second wave of COVID when we ran out of the oxygens. Okay, how we could have optimized that. Consider when we were not having enough caregivers, and caregivers who are working possibly like 3 days without sleep. They had symptoms of burnout in last August, September, because from last possibly April till August they were working tirelessly, and they were having total burnout symptoms. Plus, like obviously, like it is a pandemic which is airborne, and they were also getting susceptible to this without any rest. Now, how can you solve this particular part? I think like this technology piece, which I'm saying, came to a rescue to a certain level. I think it will come to more rescue over a period of time, where we will able to really work with a, I can say, whatever the number of health caregivers we have it, and then the asset management piece of it. If we just look into the supply chain of I can say entire medical industry, okay, people don't even know where my ventilators are lying. You saw an examples, I think, possibly in the news in last September. There were tons of ventilators we are lying ideal in some states in India, which was not utilized, and people were actually like dying in a want of a ventilator, right? So if you do a decent asset management, and what does it take? It takes just putting RFIDs on all your I can say devices, and then you can track it. This entire IoT is going to become pervasive on a hospital environment, and you will able to say where is a, I can say, ventilator, where is the oximeter, where is all anything which is required for my any surgeries or anything, and this would be easily done using this IoT technologies. Now, the second thing, what you also said earlier part of it, that the expert sitting in New York, can it give possibly somebody who is in Latur district village in Maharashtra, and this could be possible with both like combination of 5G and AI over it. So now just see that, can you right now, what is the major problem in villages, that if you do even a CT scan, MRI scan, you would not get a doctor to interpret it, and that's why what they have to do is they have to come to normally to the metros and do a CT scan, MRI scan, and then find a, I can say, somebody who can analyze from a radiology department. Most of the time they keep on delaying it down till the symptoms are so heavy, and by the time is wasted, and then they lose their life. If I would have, let us say, a CT scan machine in a village, okay, and a technician just doing a CT scan, and you can do a real time transfer to the metros like in Mumbai or anywhere else, or even the best surgeons in, let us say, New York, and say that okay, you can wait, you can come after 4 months, or possibly you need to be on the next train tomorrow. That life could have been saved, right? So with even a limited doctors which are going to be in a village, this technology of imaging, getting over a high speed network, and that's why 5G is a game changer. 5G is not only about a speed. 5G is having two things apart from the speed. One is all about that it guarantees the transfer of images on the speed which has been, I can say, qualified for. So it guarantees like your electricity, I can say, the quality of service. That is one part. So like if the electricity goes in an operation room, 5G, if it was electric, the backup comes up, right? And you don't have a problem in operation in hospital. Same thing happens in 5G, that if the network goes down, you have a backup networks, and it will really make sure that you never lose your connectivity. So that is one piece of it. And second thing, it is having a absolutely low latency, which means that if you have at certain point in time, let us say near the hospitals, 1500 people just doing some tweeting because something major is happening, there is a want of oxygen or something, all of a sudden the speed will drop if you are on 4G, because multiple people are trying to use the same pipe. In this
Yeah.
case, in 5G, it doesn't have that particular part, it doesn't have. And what it will do is that normally it does an instantaneous transfer. So like if you are watching a YouTube video or something, and in this case CT studies or MRI studies are like a videos, it takes its own time to get the first frame, and then it starts. So though you are on a high speed network on a Wi-Fi, it takes a little delay. In 5G it will not happen. And that's where somebody sitting in New York or somebody sitting in Mumbai can do a real time surgery with the assisted, possibly a maybe the MBBS doctor getting guided by a expert MD sitting or surgeon sitting out of Mumbai, and he can still operate a critical case, and you will have a life saving things even with a scarcity of a doctor. So the technologies what you are seeing here are the game changers. It is not about only like a gamification and some geeky applications which nerds are playing on the gamification part. They are very important, and you should have it down. But the real 5G test cases are here, where you can see that how it can make an impact to your life.
And thankfully, we have a date now. As of yesterday, the government has announced that 5G is going to come out sometime next year, and it's even listed the locations which are the metros right now. But as of now, but at least it's a start, and we are going to hit the 5G highway soon. So before we wind up, one last question to ask you, and I come back to COVID. So if you were really thankful for one technology in the past couple of years, um, uh, having to help the world, if you can name one technology, what would that be that you were very happy that we had it when the pandemic hit the world?
Can you just imagine what would be the situation of India if we didn't have a mobile phone? Just think about it. Okay, what could have happened? This would have been total disaster. Like, I think people in villages would have not even survived it, right? Now, if you take from that mobile part of it, in a background, it is a IoT technology where you have a lot of sensors in your mobile inbuilt, and then it is transferring the data through the cloud. So in a way, it is IoT cloud combination, and then you are harnessing the power of data. So these are the technologies which is going in a background. But I would say that to a layman, if there was no mobile, I think like there would have been no life in this time. I know that there are misuse of mobiles and people talk a lot about it, but at least in last 2 years it has been a savior, I can say. Remote working, where most of the times people were having a huge question mark on whether we would able to work from home or not. This particular part of combination of laptops, uh, tablets and mobile has enabled, I can say, work from home. Our economy is bouncing, otherwise we would have died of hunger and so on, right? Now in this case, everything has happened because of this combination of IoT, cloud and data, that actually has helped the world. So in a way, we were always thinking that this analytics and AI would come at its own time, but you are not even knowing that pervasively it has entered your life.
Thank you, sir, for a very insightful conversation on how technology is helping our healthcare sector and how we are actually better off in the past couple of years because we had the technology to fall back to. So you were listening.
One comment.
Yes, sir,
One
absolutely.
comment I have, one comment I
Yeah.
have it before I possibly like you make your closing remark is that see, like all the technology companies based out of India are doing, I can say, tremendous work for the world leaders across the globe, and entire healthcare segment, if I will say, like a reasonable amount of work which has happened in last 2 years has happened out of India. Okay, and there has to be some way in which there has to be a larger government and I can say industry collaboration, where what we do for outside India should also be tapped for India. There is a lot of things which industry can offer for India. There are certain, I can say, like things which always we talk about, that how we can have that entire public private partnership type of things. Everything is accelerated. This particular part, if it was made easier, and if there is a way in which industries can collaborate with government to provide this solution, I think you will see that India would not only have everything, but it would be a leader in digital in healthcare space. So that's what I'm saying. I think like we have some work to do there. Industry bodies are working on it, and I'm hopeful that the solution will come soon. But that's one part. If we can remove that little bit of red tape out of it and become a very faster and agile on that particular part, we can definitely be the world leaders in healthcare space.
As you said, yes, we can be world leaders in this space, and we are already ahead of the curve, as you mentioned
Right.
earlier.
Yep. Yep.
You were listening to Mr. Atul Kurani of Capgemini Engineering. Sir, thanks a lot for being on the show.
Thank you very much. Thanks for having me, and wish you all the best. Stay safe. Still, I can say the virus is not gone. Please don't lower your guard and be at home unless required. Please don't step out. If it is required, please wear your mask. Thank you.
Thank you, sir. This is Nandagopal saying bye, and you're listening to Our Own Devices with Nandagopal Rajan. We are here on all the platforms you listen to your podcast. Until next week, goodbye.